Good afternoon, everyone. Hello, 各位午安或者係早安 depending on where you are. And so we want to welcome all of you. 咁咧，我咧就係劉淑賢咧，就係呢個加州大學舊金山分校亞裔健康研究院嘅主任。So I'm Diana Lau. Most of you kind of know me by now if you've been attending this town halls. I'm the director of the Asian Health Institute at UCSF. Today with us is Dr. Janice Louie and her staff, Miss Michelle Wong. 醫生咧就會係同我哋講呢個結核病嘅即係你應該知道嘅嘢啦。咁兩種嘅結核病啦，同埋咧嗰個疫苗啦，同埋係點樣先知道你有結核病嘅咧？要做啲咩檢查咧？咁嗰啲症狀有啲咩嘢？你點樣要自己留意自己啊？點樣等啲結核病唔會再翻發啦？咁呢啲都係非常之重要嘅問題嚟嘅。
Thank you for having me. I'm the medical director of the TB clinic. The last slide just shows our building, which is on the San Francisco General Hospital campus. And this is where I and Michelle and a team of doctors and nurses and epidemiologists and health workers and disease control investigators all work together to try and help our patients in San Francisco who have TB. So I'm here to just explain the basics. I'm motivated because we see a lot of patients from China, from other parts of Asia with TB, and Michelle and I are here to increase awareness about how important it is to recognize symptoms and get tested.
呂醫生好有幸喺度同大家講解肺結核病，佢係我哋嘅醫學主任，專係我哋呢個診所係專係治療肺結核病，三藩市居民患有肺結核病嘅。咁我哋會同你哋講解關於肺結核病嘅知識。
So, what is TB? TB or tuberculosis is a germ. It's actually a type of bacteria that can cause serious lung infections and also infections in other parts of the body.
咁肺結核菌咧係一種會引起嚴重肺部感染嘅細菌，佢唔係病毒，只係同病毒唔同嘅，所以同 COVID-19 新冠肺炎係兩種完全唔同嘅疾病，一種係細菌 ，COVID-19 係病毒。
Many people think that TB is something to not worry about or it's a disease of the past, but actually it's affecting many persons in the United States, especially for those born in another country. And in fact, 1 in 7 Asian Americans in California and in San Francisco actually has tuberculosis infection. We're going to talk more about how this is an important disease to both look for and to treat.
咁結核病咧唔係一個過去式嘅疾病，佢而家仍然影響咗好多嘅美國人，特別係嗰啲喺其他國家出生嗰啲人啦。咁喺加州嘅亞裔入邊，7個人之中就有1個係有潛伏性嘅結核病。咁早期嘅檢查同埋治療係可以幫助到你預防病啊，同埋感染到其他家人嘅。咁所以我哋都會建議你同你嘅家庭醫生討論即刻接受檢查，睇下有冇患有潛伏性嘅結核菌。
This figure shows TB in San Francisco in 2022, and this is active TB, so TB in the lungs and other places. And you can see in 2022 that Asian Americans had nearly 12 times the rate of TB compared to non-Hispanic white as a reference, but also much higher than Hispanic Latino or non-Hispanic Black populations in San Francisco.
咁我哋而家睇緊嘅係2022年三藩市患肺結核病嘅數目啦，包括係肺部嘅結核病同埋唔係肺部結核病。咁總共個數據就顯示亞裔嘅結核病發病率咧係白人嘅12倍，提高好多嘅。
And within San Francisco, the neighborhoods with the highest TB rates are in Chinatown and the south of Market. And this pattern has persisted for several years.
咁喺三藩市入邊啦，邊啲地區係 比較多肺結核病例嘅，分別係有唐人埠啦，同埋市場街嘅南部。呢個咁嘅情況咧，已經持續咗好幾年㗎啦。
The rate in all of San Francisco is about 8 per 100,000. This is just how we measure TB concentration. But in Chinatown and south of Market, you can see that it's 30 and 23 per 100,000. So it's much higher than the general San Francisco rate.
咁喺三藩市總體嚟講，有81萬個人，10萬個人之中咧，有8個人會有肺結核病。但係單係喺唐人埠咧，就已經有32個人喺10萬個人之中有32個人患有肺結核病，咁所以個比率係比較高嘅喺唐人埠。
Chinatown is also one of the poorest neighborhoods in San Francisco. It has an approximately 33% or 1/3 of people living in poverty. And this partly due to a large concentration of single residency occupancy units or SROs, where people live in very crowded, poorly ventilated living conditions. That, along with poverty, are risk factors for acquiring active TB.
唐人埠亦都係其中一個最貧困嘅社區啦，喺三藩市入邊。咁佢嘅貧困率咧係達到33%嘅。咁大多數都係集中喺嗰啲散房單位啦。有幾個危險因素令到肺結核病增加嘅機會，就係因為佢哋住嘅地方好細啦，好逼傑啦，又通風嘅地方又唔好啦，空氣流通唔好，咁同埋佢哋屬於貧困線，都係肺結核病嘅危險因素嚟嘅。
And so just to talk about TB, there's 2 types of TB. There's one that's active or awake disease, and there's one that's called latent or sleeping infection. And they are not the same. Active TB can be a deadly disease. Latent or sleeping TB can be dormant in the body or sleeping, and people may never know that they even have TB.
咁好多人都話，一聽到肺結核病就話我冇肺結核，咁好多人都會有咁嘅想法嘅。但其實佢哋唔知道，亦都唔清楚肺結核病係分2種嘅。一種咧係叫做活躍性，亦都可以叫清醒類嘅疾病啦。嗰種係傳染性嘅。咁另外一種咧就係叫潛伏性，亦都係可以叫做休眠式嘅感染。咁佢哋2種係唔同嘅。咁肺結核病咧，亦都可能係一種可致命嘅疾病，但係休眠性嘅肺結核病咧，就可能係已經喺身體入邊處於瞓緊覺嘅狀態好耐啦，所以個病人永遠可能唔知道自己係有呢種潛伏性嘅肺結核病嘅。
Let's review the risk factors for getting TB.
咁而家我哋想講下有啲咩因素係令到你會患上肺結核病嘅？
Here are the most important risk factors. Anyone born outside of the US, including countries where there are high numbers of TB cases. So China, the Philippines, Vietnam, and Central America are the most common countries of origin for active TB patients in San Francisco. The next category is persons who are immunocompromised. So they might have HIV, they might be organ transplant, they might have kidney disease and be on dialysis, they might have diabetes, or they might be on immunosuppressive medications. All those different types of immunocompromised conditions put you at risk for getting active TB. And finally, anyone who's had contact with someone in their lifetime who has TB in the lung has a risk factor for also developing active TB themselves.
咁要發展成為活躍性，即係會有傳染性嘅肺結核病嘅危險因素，包括嗰啲喺美國境外出生嗰啲人啊，包括係中國、菲律賓、越南同中美洲啦。咁亦都係包括嗰啲免疫系統低下嘅人，包括嗰啲係患有 HIV 艾滋病毒嗰啲病人，曾經做過器官移植或者患有腎臟疾病啊、糖尿病啊。同埋需要使用免疫 抑制藥物治療嗰啲人。另外曾經與肺結核病人有接觸過嗰啲人咧，亦都會增加咗佢哋患病嘅危險因素嘅。
What do you feel like if you have active TB or TB in the lungs? You can feel very sick, and the symptoms can overlap with cancer, and so it can be hard to tell. And this is why it's important to see a healthcare provider. So the symptoms can include cough, fever, weight loss, and being very, very tired.
就開始有疑問，就係話咁我點先係算有活躍嘅性嘅肺結核病啊？會有啲咩症狀㗎？咁症狀就可能包括，首先你會覺得好唔舒服啦，你成個人嗰啲症狀同嗰啲癌症嘅症狀亦都可以相似重疊，就係包括好似係有咳嗽啊、發燒啊、體重減輕同埋好攰、好攰、好攰，冇原因咁樣活嘅。
However, 20% of people who have TB in their lungs don't have any symptoms, and they don't know they even have it. So that's concerning because even if you have no symptoms, you can spread active TB to your family and your friends. Again, emphasizing the importance of getting tested and seeing a doctor.
咁雖然大部分嘅人患有活躍肺結核病咧，都會覺得好唔舒服嘅，但係仍然有2成嘅人咧係會有乜嘢症狀都冇，所以佢哋都唔知道自己患有肺結核病。咁就算你係冇任何症狀出現嘅，但係只要你患有活躍性肺結核病，你都係可以將肺結核病傳染到俾屋企人同埋朋友。
So active disease most often occurs in the lungs, and what happens is those TB germs are inhaled and are in the lungs and are actively replicating and growing as far as the amount of disease over time.
咁通常咧，活躍性肺結核病咧都係喺個肺度開始慢慢繁殖啊，咁所以由肺部開始感染。
And so, once again, those persons who have active TB disease, when they do have symptoms, they're going to have fever, cough, no appetite, weight loss is a big concern, feel very tired, and sometimes even coughing up blood. And these symptoms can be persistent and last for weeks to months, and in our patients, sometimes years.
咁肺結核病嘅明顯症狀包括有發燒啦、咳嗽、冇晒食慾啊、唔想食嘢啊、體重下降啊、得好犀利啊，呢個係好明顯嘅一個症狀嚟嘅。咁同埋好疲勞啦，成日覺得好疲勞，有時亦都會出現咳血呢個症狀。咁呢啲症狀咧有可能持續幾個禮拜到幾個月都唔定嘅。
So just again to review, to ensure we can recognize these: night sweats, fever, chills, feeling very tired, weight loss, losing your appetite, cough for longer than 3 weeks, having pain in the chest, or coughing up blood or sputum. All of these can suggest lots of different things: an infection, a pneumonia, cancer, but they also can be TB.
咁有可能肺結核病會出現嘅症狀咧，包括有夜晚黑出冷汗啊，成張被都濕晒啊，要換衫啊，又或者發燒啊、打冷震啊、非常之極度疲倦啊、體重減輕啊、冇晒食慾啊，或者咳嗽多過3個禮拜或者覺得個胸痛啊，或者咳血同埋有痰。咁呢啲症狀咧，亦都可以係其他疾病嘅先兆嚟嘅，譬如係感染啊、肺炎啊、癌症，亦都有可能出現呢啲相似嘅症狀。
This is a normal chest X-ray. This is one of the first tests we do when we're looking for TB in the lungs. And the white are bones and soft tissue, and the black is air. And so you can see in this chest X-ray the bones and the ribs, and then in the middle there's the heart and the spine. And this is what a normal chest X-ray looks like in someone who's healthy and who doesn't have TB.
咁呢一個咧係一個正常嘅胸部 X 光片， 通常我哋要判斷個病人有冇肺結核活躍性肺結核病咧，我哋會同佢照個 X 光片嘅，呢個係第一步嘅檢查。咁你見到黑色嗰啲咧係兩邊黑色嗰個係個肺嗰啲係氣嚟嘅，嗰啲係正常嘅。中間嗰啲就係個心啊，同埋嗰啲器官咯。
Now these X-rays show people who have active TB in their lungs, and the TB can actually cause holes in your lungs called the cavity. This is actually a sign of fairly late disease. And the cavity is filled with TB germs and pus that's just growing and killing more and more lung around it.
咁你而家見到呢一幅係唔同嘅，同頭先嗰幅唔同嘅 X 光片啦。呢個咧就係你會見到個肺度係唔清㗎啦，有啲白色嘅由左邊嗰度，跟住同埋咧喺右邊嗰幅 X 光片度，喺個右邊肺嘅上角嗰度咧有個窿窿，跟住外邊又有啲白色嘅包住。呢啲咧就係所謂嘅窿啦，空洞啦。咁喺空洞入邊入邊已經充滿晒啲肺結核菌同埋膿液喺入邊㗎啦。
And so this X-ray shows when the TB germs actually get into the blood. So they've gone from the lung and they've gone into the blood vessels, and they can fill up the entire lung. This is called miliary TB because there's little seeds everywhere of TB. And the concern is once it's in the blood, the TB then spreads to many other sites like the bladder, the kidney, the skin, the eye, joints, and bone. TB in our clinic has been diagnosed almost everywhere in the body.
咁當你見到呢一個 X 光片嘅時候，佢好明顯已經顯示到嗰啲結核菌已經係由啲血管度擴散到去其他地方㗎啦。咁肺結核菌咧係可以由血液擴散到成個肺個血管，咁呢度全部花晒一點點嗰啲咧已經係證明咗佢擴散咗成個肺部。咁同時肺結核都可以擴散到其他器官嘅，譬如係膀胱啊、腎臟啊、皮膚啊、眼睛啊、關節同埋骨骼啊。咁所有差唔多所有嘅器官，我哋亦都見過有病人係有肺結核病喺嗰啲器官度。
And so one of the worst complications of TB is it can spread to the bones in the back and cause severe pain and even paralysis. And what these pictures show is total destruction of the little bones in the back to the point where we have a patient like this right now who is from China who is actually paralyzed and can't walk very well. So TB can really cause a lot of severe complications.
咁你呢個圖咧係一個病人個脊椎嘅 X 光片嚟嘅，咁佢好明顯見到佢啲肺結核菌已經破壞咗佢個骨嗰啲組織㗎啦，喺個脊椎後邊。咁佢擴散到去肺部嘅骨頭之後咧，就會引起嘅劇烈嘅疼痛啦，同埋癱瘓。咁正正我哋現在係有個病人係患有呢個病，咁所以其實佢已經係癱瘓咗，係眠床，要瞓喺度喐唔到行唔到㗎啦，咁所以係可以好嚴重。
And this is one of the worst outcomes. This is TB that has spread to the brain. And so you can see that they are causing actual holes in the brain, and then the dark area around the holes is swelling and edema. And so this is a really, really worrisome condition to have associated with a high death rate. So this is a common place for TB to spread in infants and young children and can be very severe.
咁而家你見到呢個咧係個頭部嘅圖片啦，咁係呢個係話個肺結核菌係喺個腦部嘅，叫做腦部結核病。咁亦都見到喺個腦部出現嗰啲空洞啦。咁呢個係一個最致命嘅地方患有肺結核病嘅，喺個腦部。咁呢個肺結核病喺個腦部通常都會喺初生 BB 度傳播啊，同埋啲病情係非常之嚴重嘅。
How does TB spread? So when a person has TB in the lungs, it can spread to another person not too far away. And it spreads to the air when someone is not only coughing, but they can just be talking, laughing, or singing. So anyone within the vicinity of this person can be infected with their TB germ.
咁當一個人話有肺結核病嘅時候咧，肺部有肺結核病嘅時候，佢嘅結核菌係可以人同人之間咁傳播嘅。就算佢唔係對住佢咳啊，佢當然咳佢會有，同埋就算嗰個人個病者對住你講嘢啊，同你大笑啊，或者同你唱歌啊，嗰個肺結核菌係可以通過空氣喺人與人之間傳播。
And so just remember, TB is spread mostly through the air from people who have TB in their lungs. It's not spread by sharing toothbrushes or kissing or shaking someone's hand or sharing or touching bed sheets or toilets or sharing food or drink or eating utensils. It's mostly with coughing, talking, laughing, singing.
咁肺結核病咧係唔會通過一齊共用牙刷啦、接吻啊、握手啊，或者接觸到床單或者廁所，同埋或者分享飲食而傳播嘅。咁最主要傳播嘅途徑就係對住你咳啊、同你講嘢啊、或者唱歌，呢啲係比較大機會傳播到肺結核病。
A lot of people will say to us in the TB clinic, but I was vaccinated against TB when I was a baby, and they'll show us a scar. So the BCG vaccine is given to babies and children in countries where TB is very common. It's not in the US, but in other countries. But that vaccine only protects young children, and it can protect them up to age 5. But after age 5, patients are not protected and they can still get very sick from TB. So the vaccine is not a lifelong vaccine. It protects the very young children.
咁喺常見肺結核病嘅國家啊，譬如中國啊嗰啲國家咧，嗰啲嬰兒同兒童咧，通常都會有接種卡介苗呢樣嘢，即係好似喺個手臂度有個疤咁，我都有嘅。咁呢個係好普遍嘅，喺啲肺結核病常見國家都會咁樣做嘅。咁呢啲疫苗咧，淨係可以保護到啲嬰兒同細路仔，直至到佢哋5歲。過咗5歲之後咧，佢哋就冇咁嘅保護力㗎啦。咁呢個疫苗係可以預防兒童受感染嚴重受感染嚴重嘅肺結核病啦，但唔係100%有保護嘅作用。喺美國係已經唔會再俾同啲嬰兒啊或者係兒童接種卡介苗呢樣嘢嘅，只不過喺亞洲地區先會出現嘅啫。
So as I mentioned, the vaccine does not protect anyone typically over age 5 and on up into adulthood. So almost everyone, both adults and children who we see in the TB clinic in San Francisco who is diagnosed with active TB has been vaccinated and they still get TB.
咁頭先講過啦，結核病嘅疫苗係唔可以保護5歲以上嘅人，因為佢嘅保護免疫保護力係直至到5歲，咁所以呢個疫苗係唔可以保護年紀大嘅兒童啦，或者成年人、活躍性肺結核病嗰啲人啊，包括細路仔同埋大人啊，都係曾經接種過呢個卡介苗結核病疫苗嘅。
However, TB is curable. So unlike cancer, if you catch it early enough, it's 100% curable. There are many pills that you have to take, and it can be really daunting, and it can last 6 to 9 months, but you can cure TB. And I put here at the bottom some pictures of the pills you would take in the first 2 months, and then the pills you would take after for the next 7 to 9 months. So the other advantage of taking treatment is that it can reduce your infectiousness very quickly, so you don't infect your family and friends.
咁肺結核病可以醫治嘅，咁好多人話：哎呀，肺癆啦，死得啦！以前舊嘅年代係未有咁多藥物嘅時候咧，係非常之致命嘅。但係而家有新嘅藥物出現啦，咁肺結核病係完全可以根治嘅，佢同癌症係唔同嘅。咁治療肺結核病咧，需要6到9個月 服用比較多嘅藥物啦，嚟殺死嗰啲結核菌嘅。咁同癌症唔同嘅就係、如果盡早發現肺結核病，佢係可以100%醫治好嘅。咁同埋預早接受肺結核病嘅治療，亦都可以迅速咁降低傳染性啦。咁你見到嗰兩幅圖，左邊嗰幅咧就係、頭嗰8個禮拜需要服用嘅藥嘅份量啊。咁右邊嗰個圖就係、之後嗰16到28個禮拜需要服用嘅藥物係少好多嘅。
Early TB treatment, when you first think you have symptoms, any of those symptoms I mentioned can be life-saving. If a patient presents too late, the TB disease can be too severe and treatment will not be always effective. So it's really important to see your doctor soon if you have any symptoms that might be TB.
咁咧，如果患者就診得太遲啦，個病非常之嚴重，咁結核菌亦都可以係好廣泛咁傳播晒，因為太遲，所以導致治療無效，或者係冇咁好效果。咁所以盡早診斷係一個好有幫助個患者。如果你有任何可能係肺結核病嘅症狀啊，就算你懷疑係咪，你都可以同醫生聯繫盡快。
So this is an important slide. Since January 2020 up till last month, this is the distribution of different populations in San Francisco who have been hospitalized or died due to TB. And you can see that patients who are born in China account for most of the persons who are hospitalized or dying due to TB. They're often older. They often have disseminated disease in the lung and in the sometimes in the spine or the brain or even the bone marrow. Their median age is 75 years. But the reason really why I came here to Diana and brought Michelle with me to talk about is this actually is unacceptable. So people from China are dying from TB at much higher rates than everybody else. And I wanted to bring awareness to the importance of seeing your doctor if you have symptoms that we reviewed that might be TB.
咁而家呢個圖咧係顯示喺2020年1月份到2023年9月份呢段時間患咗肺結核病嘅病人住院人數同埋佢嘅死亡人數嘅。咁呢度好明顯顯示三藩市嘅華人住院率咧係比任何一個國家都高嘅，同埋佢嘅死亡人數亦都係最多嘅。咁因為呢啲病人咧好多時都好遲發現，所以佢哋除咗佢哋係比較年老啦，免疫力好差啦，同埋佢哋亦都係有擴散到去其他器官，包括係肺啊、脊椎啊、腦啊或者係骨髓嘅。咁呢個亦都增加咗佢哋死亡嘅。咁最有可能患有嚴重肺結核病係中國嚟嘅老人啦。大概中位數係75歲左右嘅，咁所以係劉醫生係好想同大家呼籲就係、如果你係有任何肺結核病嘅症狀，要及早盡早去見醫生嘅。
You can prevent this because before active TB often comes first latent or sleeping TB. So the TB germ is in the body and it can be sleeping for many years. When it's sleeping, patients don't feel any symptoms and they're not infectious.
休眠式嘅肺結核病入邊咧，細菌係可能喺身體入邊已經存在咗好一段日子，但亦都可能出現話係已經係處於休眠多年狀態㗎啦。咁雖然如果你患有休眠性嘅肺結核菌，即係潛伏性嘅肺結核菌啦，你係唔會有傳染性，亦都唔會感到有任何症狀嘅。
And so we advise all our patients that if they have sleeping TB, it's important to take the pills to kill the germ while it's sleeping before it wakes up and makes you very sick. Treating sleeping TB also protects your family and your friends from getting the TB germ because you may be infectious before you even feel sick from getting active TB in the lungs. So it's really important to identify people who have sleeping TB.
咁潛伏性或者休眠性嘅結核病咧，係最重要係喺佢仲喺你身體入邊瞓緊覺嘅時候嚟服用藥物嚟殺死佢，免得佢第日會復發，令到你病啦，會甦醒令到你病，咁你就等於患有活躍性嘅肺結核病，咁就係會傳染嘅。咁治療呢個潛伏性休眠性嘅肺結核病係仲可以保護到你啲屋企人同你朋友唔會受到肺結核菌嘅傷害啦。因為就算你係未有症狀之前咧，或者你都已經係有傳染性嘅，已經係未出現症狀任何症狀之前，你已經係有傳染性，你係傳染咗俾人哋自己唔知嘅。
And it is much easier to treat latent TB or sleeping TB early before it develops into active TB disease that's infectious. There's many less pills are required to treat sleeping TB. For example, you can take these 2 red pills every day for 4 months, or take these 10 pills once a week for 3 months, and that will kill the TB germ sleeping in the body.
咁同大家提醒下啦，頭先提過嘅治療活躍傳染性嘅肺結核病咧嘅療程係6到9個月啦，但係呢一個預防治療潛伏性同或者休眠性肺結核病咧，佢個療程咧係短好多嘅。咁左邊嗰兩粒紅色嘅藥物咧係其中一個方案，就係食4個月嘅。咁右邊多少少白色嗰幾隻咧，嗰種方案咧就係食3個月嘅，1個禮拜1次嘅。咁相對於活躍肺結核病嘅療程同埋藥物嘅份量，你潛伏性嘅肺結核治療係少好多㗎。咁所以我哋係盡量想喺佢變成活躍肺結核病之前，盡早治療咗佢啦，同埋就會等佢減少佢第日變成活躍肺結核病嘅機會。
So you can test for TB infection or sleeping TB with a blood test to find out if it's in your body. And I'm just going to show you that when you test for sleeping TB, there are 4 tubes of blood, but you only take this much in each tube. So it's not a lot of blood. And then if you have the diagnosis of sleeping TB, you can take the pills which can protect yourself and people close to you by killing the TB germ that's sleeping.
咁肺結核病潛伏性嘅肺結核病嘅檢查咧，我哋係通過驗血嚟做嘅。咁主要係睇下你有冇受到結核病嘅感染啊，同埋睇下你身體入邊有冇患有肺結核休眠肺結核病毒嘅。咁頭先盧醫生俾你睇到有4支試管，其中一支試管咧係淨係需要大概1個 ml 咁少嘅血嘅啫。咁呢個測試係專門係睇下你有冇肺結核潛伏性肺結核病嘅。咁就算如果發現係有嘅話，而你個 X 光片係正常咧，咁醫生就會建議你食藥嚟保護你自己啦，同埋你身體嘅人，同埋將你身體入邊嗰啲肺結核菌殺死嘅。
The latent TB has no symptoms, and a lot of times when we go and see our primary care physicians, they don't necessarily just order this test for us. Is there a specific name for this test for the latent TB that our audience should know, that they can ask their doctor to order if, let's say, that they are immigrants from China and they have a higher proportion of risk? So what is the name of this test? How should they tell their physician, can you please order this test for me?
That's a great question, Diana. So these tubes are a test called the quantiferon test, or QFT. So you want to make sure you ask for the blood test. And again, not that much blood. So it's called quantiferon, or sometimes you call it QFT for short.
如果你唔知點樣同醫生講話你想驗呢個肺結核菌嘅血液檢查咧，咁佢有個簡寫叫做 QFT T， 咁個全名就叫做 quantiferin。咁你就咁俾個3個數字、3個英文字個醫生睇咧，佢都會明白㗎啦。你個家庭醫生，你只需要同佢講話你想檢測呢一樣嘢，咁佢就會明白。
So Michelle and I want to thank you for listening. Our mission is to protect San Franciscans from getting TB disease, getting in their lungs, infecting others. And we are especially passionate about treating the Asian population. So thank you for listening. And I think we're happy to answer any questions.
咁我同雷醫生有幸可以喺度同大家講解呢個肺結核病嘅類型啊、治療方案啊，咁希望幫助到更多三藩市嘅居民啦，可以清楚咁了解肺結核病嘅成因啊，同埋嘅治療方案，同埋有好多誤解嘅，亦都希望大家明白。多謝晒。
And we want to thank, of course, Dr. Liu and Michelle for such a nice lecture. So one of the things that we know and have experienced is that people who in our baby stage, and I had it too, for the BCG vaccine, when we had the BCG vaccine, it protects us for the first 5 years of our life, and then it doesn't do anything anymore. However, when we go and like at work as nurses, we have to test for TB. And so we do a skin test and it turns positive. And we're told that if you've had BCG tests before, you will have a positive skin test. So then that's not reliable. Then you have to take an X-ray or you have to answer some questions about symptoms. So can you explain a little bit more about it?
好多時咧，我哋亦都會接受一個叫做PBD test， 就係一種肺結核菌嘅皮下檢查嘅。咁通常係曾經接種過卡介苗嘅人咧，呢個 PBD 檢查咧都會呈陽性反應嘅。咁呢個係嗰個好普遍嘅現象出現嘅。
So Diana, that is an excellent question. And Michelle and I in TB Clinic also struggle with this. So anyone who is non-US born, in my opinion, should be getting a QFT test because, as you said, that skin test is going to be positive because of the BCG. And we have been advocating for hospitals and clinics, for healthcare workers to move to QFT. Some places have been very slow because it does cost them money. But I think the problem is I don't want to get radiated with X-ray over and over again. I would much rather know with the blood test if I have sleeping TB. The X-ray only tells you if you have active TB. So this is a big challenge. And I think that anyone who has had BCG and is offered a skin test should ask, can I get a QFT instead?
咁雷醫生咧就話所有唔係美國出生嗰啲人啦，都好大機會係打一個卡介苗嘅啦。咁佢咧做皮下檢測咧係唔準確嘅。咁佢建議所有唔係美國出生嘅人咧，同醫生講，我需要做抽血嘅肺結核菌檢查，咁就唔會受到你卡介苗嘅影響。同埋雷醫生話我都唔想照 X 光咁多輻射，咁所以就算你皮下檢測係陽性，但係你個血液檢測係陰性咧，咁你就唔需要照 X 光㗎。咁所以只要需要做抽血檢查就足夠㗎啦。咁佢建議係X 光咧，淨係去判斷個病人有冇傳染性嗰個活躍肺結核病嘅啫。咁就算你係患有潛伏性嘅咧，你個 X 光片亦都唔會有見到任何唔正常嘅地方嘅。
So along that, a worst scenario is that, and I've seen this, when you come up with a positive skin test. Now, not all the physicians are aware of this Asian stuff that we get BCG vaccines, right? Because they don't give it here in the US. So when they see the positive skin test, they freak out and then started wanting to put you on 9 months of medicine to treat your TB, quote unquote TB, that they think that you have. I've seen this, so please comment on that.
Well, I think the bigger problem is we do need to do a better job of educating our physicians on how to distinguish between active and latent or sleeping TB and how to manage them. And we struggle with this all the time in TB clinic. And I don't want to get into too much of a political discussion, but TB affects people who don't speak English, who aren't born here, who may struggle with getting health care. And, this is very hard. It doesn't get a lot of attention or a lot of money. Now, contrast that with COVID. So COVID affects everybody. So there was a lot of attention right away to COVID. There was a vaccine in a couple of years for COVID. We don't have a vaccine for TB that is good for adults, even though this disease has been happening for centuries. And again, I think part of that is that there's a lack of attention and a lack of people speaking out about it and a lack of companies who care about TB because it affects people who don't really have a voice. That's my opinion, and it's very frustrating.
咁阿劉博士頭先有講過，有嘅情況就係、有啲病人做咗皮下檢測係呈陽性嘅，咁佢哋嘅家庭醫生就直接開咗9個月嘅藥俾佢哋食，就冇理到佢哋究竟係有冇打過卡介苗，呢個會影響到呢個皮下檢測嘅結果。咁劉醫生話：我哋係其實好想對其他家庭醫生或者其他嘅醫務人員講解下呢個嘅唔同嘅檢測同埋有啲乜嘢可以做到嘅。咁結核病同新冠肺炎係唔同嘅地方就係、新冠肺炎大家都喺度講係一個好熱門嘅話題，亦都係得到好多政府嘅支持好快就已經研製到疫苗咁嚟幫助控制呢個新冠疾病嘅。但係結核病已經係一個好耐世紀嘅病，但係仍然仲係存在緊，同埋佢想係多啲教育其他嘅醫療人員可以了解多啲，而利用血液檢測嚟幫助驗證有冇潛伏性嘅肺結核病係比做皮下嘅檢測係準確得好多嘅。
And not to say how serious this TB disease is that can kill us, but when it happens in younger people, it can just cause you havoc that you weren't expecting. One of the patients was actually driving, and for some reason, his latent TB broke out, went to his eye, and caused his retina to detach. So all of a sudden, he was losing his vision in one eye because the retina fell off, and so he couldn't see. He was blinded in one eye, and he was driving. And this could, the consequences could be so serious, you can just imagine, right? So you never know when it will become active if you have latent TB, and if you don't even know you have it, right? You were never treated for it. And when you get weak or your immunity goes down, and all of a sudden you get hit with it, then it can cause tragedies that are so blown up that it will cause you other major health issues.
Someone asked, if a person has sleeping TB, can they still go to work while they're taking medication? So as I mentioned, sleeping TB is not infectious. The goal is to kill those sleeping germs so you can go to work because you're not infectious. And good for you for getting tested and starting treatment for sleeping TB.
咁其中第一個問題咧，有聽眾問嘅就係、如果一個人患有休眠性嘅肺結核病，佢仲係咪可以返工即使佢食緊藥嘅期間？咁個答案係嘅。因為佢淨係患有休眠性嘅肺結核病咧，佢係唔會傳染到俾其他人嘅。 咁所以佢都係可以照常返工啊，咁食緊藥咧係會幫助佢及早殺死佢身體入邊嘅肺結核菌嘅。咁所以醫生亦都會好強烈建議佢食藥殺死佢身體嘅肺結核菌。
There are two similar questions about why isn't there a TB vaccine for adults, or is there? And as I mentioned, there is not. There's a few people working on this, including the Gates Foundation, some people at UCSF. But the problem is, again, like I was mentioning, this is not a disease that affects everybody. So in contrast to COVID, where we had a vaccine within a year, people have been working on this for decades to find a TB vaccine. And this is this is our great hope as far as eliminating TB, but unfortunately we're not there yet. And even though the TB vaccine protects kids, it's also not 100%. So just because a kid has had a TB vaccine, don't assume if they have fever or they start to lose weight that it's not TB. Those are two important messages.
咁有聽眾問係一個關於肺結核病疫苗嘅問題。咁其實成年人係冇肺結核病疫苗嘅。咁同新冠疫苗係非常之唔同㗎啦，因為佢始終冇新冠疫苗咁嚟得咁突然啊，咁嚴重啊，咁多病例，佢只不過係仍然係仲係存在嘅。咁劉醫生想同大家講嘅問題就係、雖然小朋友接種咗卡介苗係可以有保護到5歲，但係亦都唔係100%嘅。咁佢如果個小朋友出現有發燒咳嗽或者體重下降呢啲咁嘅症狀咧，你唔好忽略佢。佢冇可能有肺結核病，因為打咗針，唔會話100%保護到你嘅。咁所以當呢啲症狀出現嘅時候，亦都仍然要帶佢見醫生睇下有冇係患有肺結核病嘅機會做檢查。
There's another question about what is the price difference between a skin test and a QFT. So this can vary quite a bit. Most insurances will cover the QFT. If you go to one of those clinics, there are little pop-up clinics that offer testing for lots of things. If you need to get a passport, they'll also offer testing. I've seen it go as high as $100. However, if you have insurance, most insurances will cover the QFT. You just have to ask for it. Not always. We're getting there, but this is another challenge that Michelle and I have is the cost of the testing.
咁其中一個讀者問起關於皮下檢測同埋血液檢測肺結核病嘅價錢有咩唔同啊？咁雷醫生話佢見過最高一次嘅肺結核病嘅檢測係100蚊咯，最貴嘅。但係如果只要你又係有保險嘅話咧，其實好大機會都會係包嘅你嘅保險。總之你同家庭醫生提出啦。同埋有時喺三藩市有啲診所或者係有啲流動嘅地方，亦都可以提供呢個檢測嘅。咁所以雷醫生同我哋診所亦都想盡我哋能力去同三藩市居民提供呢一個肺結核病嘅檢查。我哋亦都好努力係做緊呢樣嘢嘅。
Can we also talk, Michelle, about the pluses and minuses? So the skin test may be cheaper. But remember, if you have a BCG vaccine, it can be falsely positive. Also, you have to come in twice. You have to come in to get the test administered. Then you have to come back 2 to 3 days later to have it read. And also, a lot of people don't have a lot of experience reading a skin test. So in our clinic, we often see people who have reported of a positive test. And when we do the QFT in our clinic, it's negative. So you need to have some pretty good experience to read that bump in the skin. So those are all the downsides. It's a cheaper test, but it's inconvenient and it's just not as accurate as the QFT.
咁肺結核病嘅皮下檢測咧，係相對嚟講係平啲㗎，但係佢亦都有佢嘅弊處，就係第一你係要嚟診所2次。嚟睇個報告嘅。第一次咧係幫你接種嗰個 皮下檢測啦，就好似有個泡泡喺你個手度嘅。咁過咗24到72小時之內咧，你亦都要翻嚟診所，係俾診所工作人員睇下你嗰個皮下檢測個泡泡有冇大到係陽性定係陰性嘅。咁呢個咧係好視乎時間啦，你係要喺嗰段時間之內翻到嚟俾診所嘅人員檢測，同埋做得啱唔啱啊？深淺啊，同埋嗰個泡泡嘅大細啊，結果測試個結果㗎。咁所以咧，我哋建議咧，所有係有患過卡介苗打過卡介苗疫苗呢個咧，亦都係需要做肺炎檢測嘅血液樣本多過，會比較好過皮下檢測，因為皮下檢測佢話見過有個病人係喺出邊做咗皮下檢測係陽性嘅，但係嚟到我哋度診所做咗抽血係冇事嘅，係陰性嘅。
Okay, there's another question that says, does fever in TB occur every day, initially, occasionally? And is there any medicine or injection to prevent when traveling to Asia? So the last part, once again, unfortunately, there's no vaccine. You shouldn't be taking medicine to prevent TB. We only have medicines to treat the sleeping TB. And as far as the fever, so it's very unpredictable. The cough, the fever, the weight loss. I think the most important clue is that all the TB symptoms you will usually last a month or longer. So if you have a cold like a virus or a pneumonia, usually the symptoms happen, maybe 3-4 days or a week you're feeling sick. But if that lasts for 1 month, 2 months, 6 months, really important to think about TB and see your doctor, get a chest x-ray, get your blood test, everything that we've been talking about.
咁其中下一個問題就係話，肺結核病嘅發燒症狀係每日啦，最初定係偶然先會見到，同埋佢問去亞洲旅行有冇藥或者針可以先至預防。咁雷醫生話好不幸係冇藥或者針可以預防呢個病嘅，係只有藥物係可以預防。係治療呢個休眠性嘅肺結核病嘅啫，就冇話去旅行係有咩針可以預防嘅。咁同埋發燒呢啲感染症狀咧，如果係持續咗多過1個月或者幾個月或者6個月或者係你有任何受過病毒感染或者係肺炎呢啲情況係唔好。長過1個月嘅時間咧，咁你就要考慮係有冇患咗肺結核病呢個可能性啦。
So, Dr. Louie, is there a gold standard for diagnosing TB? Is that the KFT test or the chest X-ray? I mean, physicians should not, I suppose, because of the false positive with the skin test, they should not start treating patients based on just a positive skin test, is it?
If you've had a BCG, they should not be treating based on the skin test. So
sometimes patients can tell them that they've had the BCG, right?
There's usually a scar somewhere, but most, especially if patients from Asia, will have had a BCG. So I guess what I want to say is it's up to patients to be proactive. Sometimes the physicians don't know as much about TB as you do after this talk. And you need to advocate for yourself because we're bumping up against busy primary care. It's expensive to get you an X-ray. It's expensive to do this test. So I want you to advocate for yourself. And if your physician has questions, they can call the TB clinic and we have people who can help answer those questions.
雷醫生就話佢建議所有喺亞洲嚟嘅病人咧，最好都係接受呢個血液檢測嘅，因為通常咧點知道有冇打過卡介苗咧，就喺個手臂有冇拉啦。咁佢亦都建議病人應該自己主動同醫生講話我喺亞洲嚟嘅，我想接受血液檢查肺結核病毒。咁因為有時家庭醫生任何即係診所亦都好忙。 佢哋未一定話好清楚個病人自己本身喺邊度嚟啊，有冇打卡介苗呢啲情況。咁所以病人所有聽眾今日聽完我哋呢個講座之後咧，應該更加深入了解咗肺結核病呢樣嘢，咁亦都可以同家庭醫生提出你想做啲乜嘢檢查啊，咁嚟保護自己嘅。
Actually, as you were talking, I'm kind of looking at my arm. I know I've had BCG tests. I don't see the scar anymore. I used to see the scar.
It can fade. It's usually in the upper arm.
And the scar went away.
Yeah, and you're not going to remember because it was given when you were a baby, right? So, but you can assume most people born in Asia have had a BCG.
I know. So we kind of know because we're Asians and, especially those from Asia. However, when you are seen by a primary care physician who is not an Asian, who is not an immigrant, and is not familiar with TB, and they might not even see the scar, or they may not even bother to look for the scar or think of looking for the scar, and your scar could have been gone anyways.
That's right.
And then you end up with a positive skin test, right?
Yeah, I think that our experience in TB clinic is primary care physicians, especially after COVID, are so busy. They're so backed up and they're burnt out. And they just cannot think of everything that they have to screen for and think about and talk to patients about. So it's really important for patients to advocate and speak up for themselves, and don't be shy about going to the doctor if you want to get tested. Or if you have symptoms, then you need an X-ray to look for that TB in the lungs, both things. Because treatment will protect your health, it will prevent you from dying, and it will protect your family.
咁雷醫生咧係好希望大家係主動咁，唔好話覺得我去問同人哋講我想驗肺結核病，好唔好意思啊，覺得怕醜，呢個係你自己嘅身體。咁佢覺得病人應該主動同家庭醫生要求你想做啲咩檢測啊，肺結核病毒嘅檢測啊，抽血檢查。因為有時自從新冠肺炎之後咧，好多診所亦都會好忙啊。咁所以你作為病人，你為自己嘅權益，你係需要同你嘅家庭醫生講你需要啲乜嘢檢查啊，同埋驗肺結核菌睇下有冇帶菌染血，咁同埋如果係帶菌嘅話，就要驗 X 光睇下有冇X 光個肺部有冇受到感染啊，咁可以盡早治療。就算係休眠性嘅肺結核菌又好。活躍性嘅肺結核菌，當你有症狀嘅時候，亦都要盡早見醫生咯。
Thank you. That's great. What do you think about everybody's talking about ChatGPT and AI and all this stuff now, right? So what do you think about building an algorithm in our electronic medical records so that the system has the built-in intelligence that have symptoms A, B, C, and D, which kind of aligns with TB, and that you, by history, and immigrants, and you're from Asia, and this and that, and then the system would be smart enough to think for the physician and give them a prompt question. What do you think about this?
Well, I mean, we do have prompts. So in many places that, especially that have EPIC, the electronic medical record, there are prompts. So if you're not born in the US, think about TB. If you are exposed to someone, think about TB. If you're immunocompromised, think about TB. I think the problem is that primary care physicians are dealing with so many different information coming in. We know so much, everything's electronic. It's really hard to keep track. So they're only human. They're trying their best to address cholesterol and high blood pressure and diabetes and cancer screening, talk about smoking. So TB ends up being a little lower on the list, but because Michelle and I see patients from China, frankly, dying of TB, we're here to raise the awareness. This is really important. I don't want to see any people dying from TB.
雷醫生話咧，好多家庭醫生診所好忙啊，而佢哋即係比較注重關心係個病人嗰啲膽固醇高唔高啊，血壓高唔高啊， 其他啲比較重要嘅問題，而忽略咗肺結核病呢一樣嘢。咁所以如果佢哋有任何問題係關於肺結核病或者有啲唔清楚嘅地方，佢哋係可以隨時喺我哋診所開診嘅時間嚟打嚟諮詢，我哋係好樂意回答佢哋嘅問題嘅。咁作為病人咧，就算你個手臂係冇見到個疤嘅，因為就算係話我細細個接種卡介苗，而家咁大個啦，個疤都冇咗啦，咁冇咗唔代表你係冇接種過。咁所以只要係亞洲嚟嘅病人咧，佢哋絕大機會亦都係細個嘅時候曾經接種過卡介苗。咁所以雷醫生話想希望其他嗰啲家庭醫生可以亦都可以唔好忽略到肺結核病呢樣嘢啦。其中有任何症狀亦都要去幫佢哋安排照 X 光同埋提供肺結核病嘅血液檢測嘅。
This is a really good question. So what are the best ways to prevent TB, like masking? And so we don't have a lot of information on this, but in general, yes, masking will help protect you against TB. The problem is when you're with your family or your close friends, you often don't mask. And because TB can be no symptoms, they might be coughing or laughing and transmit TB. It's not their fault. They don't know they have TB at all, but that's how TB is spread. So masking will help, but you can't mask your whole life 24 hours a day.
咁下邊其中一個問題聽眾提出嘅就係話，有咩嘢係可以預防到肺結核病咧？有咩方法咧？就譬如好似話我戴口罩就得㗎啦。咁雷醫生話戴口罩咧係其中一個可行嘅方法，但係當你同你嘅朋友一齊同你屋企人一齊時候，你係冇可能成日戴口罩。咁同埋當你同佢哋一齊嘅時候，佢哋或者係初期係冇症狀㗎。咁當佢哋同你講嘢同你對住你咳或者對住你哋一齊去卡拉 OK 嘅時候咧，亦都會增加咗傳播呢個肺結核病嘅機會咯。咁所以佢覺得口罩係可行，但係唔一定話咁普遍可以做到㗎。當你同其他屋企人朋友一齊嘅時候咯。
So to dive in a little deeper on the mask, how big is this TB bacteria?
It's pretty big.
So regular surgical mask is good enough?
A surgical mask should protect you. So TB is not as infectious as COVID. So that's an important point to know. COVID you can get in 15 minutes. Our threshold for TB transmission is something like 8 to 12 hours of close contact. So that's why typically what we see TB transmission, it's people who live with other people, who work with other people, say in a restaurant, who sleep with other people in the bedroom. So it's close contact for a long time with family and friends. The problem is people don't know they have TB. So you're with your family, you take off your mask, you're relaxed, you feel okay, but you may be transmitting the TB.
用咩口罩係比較適合咧？咁雷醫生就話，普通嘅醫用口罩係已經足夠保護你嘅啦。但係佢肺結核病嘅傳播同新冠肺炎嘅傳播係有啲唔同嘅。佢冇新冠肺炎咁犀利。咁新冠肺炎淨係需要15分鐘就可以傳播到俾其他人。但係肺結核病毒咧係需要8到12個鐘頭好親密嘅接觸先會可以傳播到嘅，就包括例如係一齊住嘅屋企人或者係一齊工作嘅屋企人喺啲餐館其他好畢業天氣唔流通嘅地方一齊工作8到12個鐘頭以上同埋或者一齊瞓覺一齊休息咁通常都會係喺屋企人之間會傳播，或者係好親密嘅朋友之間傳播機會大啲咯。
So I know one thing I'm going to do is next time when I see my physician, I'm going to ask them to order a QFT test for me. Because I don't know if I have latent TB because there's no symptoms. And so you don't need to have active TB before you have latent TB, right? You could just harbor the latent TB all your life, right?
Yes, it's usually the latent TB, and then it's sleeping, and then something happens. So you get older and your immune system goes down. You get diabetes and your immune system goes down. And then the TB explodes and goes in your lungs. So it's much harder to treat TB in the lungs than it is to treat sleeping TB. So it's worth testing for sleeping TB and kill it.
So the skin test would not find out the latent TB.
Well, it will, but it will also be false positive. So you may not have latent TB, but it'll be positive. And what you don't want to do is take medications that you don't need. So that's why the blood test is important.
And really for those toxic antibiotics, they really should do a liver function test before they start you on it, right?
That's right. Unfortunately, we also need to work on getting TB treatment for sleeping TB shorter because there are some side effects, and it can cause liver inflammation. So we're also very careful when we treat any TB, sleeping or active, that we check the blood to make sure your liver is okay. And no drinking alcohol while you're taking TB medications.
咁雷醫生話咧，通常休眠性肺結核病咧係喺活躍性肺結核病之前就會出現㗎啦。咁當你係患有休眠性肺結核病嘅時候咧，啲細菌喺入邊身體瞓緊覺未發作。咁當你年紀越嚟越大啦，你嘅免疫力下降啦，你好多病痛嘅時候，譬如話糖尿病啊、腎病啊、任何令到你免疫系統降低嘅病，當你患有嗰啲病嘅時候咧，你身體入邊嗰啲肺結核菌就會甦醒發作，令到你患有轉變成嗰個傳染性肺結核病，咁就去到個肺度嘅時候，咁樣你服用嘅藥物咧就會多好多啦。咁同埋同時雷醫生建議咧，肺結核病休眠性肺結核病嘅治療嘅方案咧短啲會比較好啲。咁因為咧佢始終抗生素消炎藥咧對肝臟咧係或者有一定嘅影響嘅。咁所以佢會喺食藥之前幫病人檢測佢個肝臟功能啊，睇下佢個肝功能係咪正常啊，同埋密切觀察住佢個肝功能有冇改變咯。咁所以短期嘅治療會比長期嘅治療會比較安全啲嘅。
In Chinatown, there are always men spitting. Is it easy for us to get TB germs if they have? So it is not in the spit itself, but if they have TB, they're expelling air when they're spitting. So it's possible. It hasn't been studied, but obviously if you can get TB from talking or laughing, if you're spitting and air is coming out and you have TB, you could be spitting out TB as well as the spit.
Would the TB germ be in the spit so that when the spit dries up, it vaporizes and the germs?
No, it's probably dead at that point, but at the moment the air is coming out, it's suspended in the air, and then you breathe in that air, and then you can get the TB. So it's not in the spit, but it's in the air, the breath.
係啦，下一個問題就係個聽眾就話喺糖埠成日見到好多人佢哋吐痰啊，咁係咪好容易得到肺結核病個病毒㗎？咁雷醫生話咧，佢哋吐嗰啲痰入邊咧係唔會話有呢個肺結核病毒可以傳染到嘅，但係當佢哋做呢個動作嘅時候，咳啲痰出嚟嘅呢個動作。佢吸出嚟嗰啲泡沫性就會可以通過空氣入邊傳播出嚟，咁你吸入嘅時候咧就會有機會感染到啦。
It says, if you took pills over 40 years ago, do you still need to have a QFT blood test now? So this is another sad fact, is that you don't get credit if you took TB pills 40 years ago or even 2 years ago, and then you're exposed to someone with TB again, you should get a test. And I know this is hard because you don't know if they have TB. So this is something we always struggle with. But it's important that everyone get tested, or if you're around someone who's been coughing or losing weight or having a fever, then you should get tested.
So pretty much the story. So let me comment, and then you can translate both of it, right? So so basically, when somebody got treated, took the pills 40 years ago, they were treating for whatever infection that was going on at that time, whether it's active or latent, right? TB at that time. So then, but then since then, then that part of the bacteria gets controlled and killed. But then that doesn't prevent us from getting other exposures later on in life. And then we get infected again. And so obviously the antibiotics are gone, long gone. And so if we have symptoms, then we shouldn't assume that. So the antibiotics doesn't protect us for the future.
Unfortunately, no. Yeah. This is why we need a vaccine.
And we have no vaccine.
That's right. We need to have more attention focused on getting us a vaccine. We know we can do it because we did it for COVID. We can do this if we had enough money and attention and political will.
下一個問題就係話有個讀者問，聽眾問，如果我40年前食過藥，咁我仲需唔需要抽血驗肺結核病毒咧？咁個答案係要嘅，因為無論你係40年前食過藥又好，2年前食過藥都好，你身體入邊嗰啲消炎藥嗰啲效用已經係冇晒㗎啦。咁同埋呢段時間，如果你有接觸到過有其他人係有肺結核病嘅症狀啊，譬如咳啊、發燒啊、體重下降啊，只要你係有曾經接觸過呢啲病人咧，你亦都係有感染有機會受感染啦。咁所以你都係仍然需要做個肺結核血液檢測嚟睇下有冇受到感染嘅。咁好不幸地，而家係冇疫苗打預防呢個肺結核病。咁雷醫生話，亦都好希望係喺將來有一日係會有呢個疫苗誕生，係可以預防肺結核病嘅。
This is a harder one. How do we advocate for a TB vaccine? So this is all very political and it's frustrating. That's why Michelle and I are here. We want to raise awareness. Talk about it, write your congressperson. You know, it all comes down to research money comes from the Congress and they decide what they want to give money to. There are Asian coalitions out there that are trying to work on awareness. So I think if you Google it, you can find lots of different efforts that public health and advocates are participating in. And this is also what Michelle and I are trying to do. But talk about it more. Ask your doctor. Talk about it with your family and friends. Write your congressperson. That's how we do it here. And, you know, we just have to keep talking about it. Keep it in the conversation.
最後一條問題係有個聽眾問，咁我哋點樣先可以要求或者係倡導製造一種治療肺結核病嘅疫苗預防肺結核病嘅疫苗？咁雷醫生話呢個係一個非常之好嘅問題，都係一個好有挑戰性嘅問題。因為呢個係關乎政治方面嘅因素啦。咁其實只要你多啲同屋企人傾啊，同朋友傾啊，將呢個肺結核病呢個話題係可以將佢傾下，大家人都知道呢樣嘢嘅存在啊，亦都係想有同一個目的，就係製造出一隻疫苗係預防肺結核病嘅，或者寫信去俾國會嘅議員啊，將你嘅意見提出，係我哋係幾咁想有呢個疫苗嘅誕生，咁或者係亦都係對有幫助嘅。咁呢個亦都係我同雷醫生喺度嘅目的，就係想同大家倡導呢個肺結核病嘅預防同治療方案。咁希望大家可以唔好忽略到呢樣嘢咯。
People are very smart. They're asking harder and harder questions. This question is, how long does the treatment for latent TB last? After 3 months treatment, you can still be exposed and contract TB again. And the answer, unfortunately, is yes. So part of the awareness is If you have friend or family, that's most likely where you're going to get your TB, or someone you work with. If they're coughing, if they look sick, if they are losing weight, you should probably mask and probably stay away if you can and say, hey, you need to go see the doctor. You may have TB. So one of the most important things is it's unlikely you're going to get TB from a bus or from walking by someone in the street. Remember that it takes usually 8 hours or more to get TB. So these are actually people you know who are likely giving you TB. So take care of yourself and take care of each other because they may not know and say, hey, maybe you have TB, get tested.
咁下一個問題就係話，如果我食咗藥3個月預防休眠性結核病嘅話，而我又再接觸到人有肺結核病，咁我係咪仲要繼續食藥啊？咁個答案咧係有可能係㗎。咁所以當你身邊有屋企人或者同親密嘅朋友出現到有發燒啊、咳嗽啊，同埋有體重下降咁嘅症狀咧，你就要提醒佢哋，叫佢哋去馬上檢測有冇肺結核病啦。咁通常咧，肺結核病傳播係喺屋企人或者係親密朋友之間啦。因為頭先有提過，佢嘅傳播時間係至少接觸係有8到12個鐘頭先會可以傳播到嘅。咁所以當係就算你有人喺你身邊行過，有人係有肺嘅病喺你身邊行過，或者係你坐巴士啊咁短暫嘅時間咧，係你唔會受到感染嘅。
I think we've covered all these topics. A lot of people asking about the skin tests, and I think we already talked about how it will show up in the skin test, but also it can be falsely positive. So you don't want to take medications if you're not really having TB and the test doesn't tell you that, because then you don't want to take medications unnecessarily. So the blood test is better.
Great.
咁雷醫生最後個問題就係如果皮下測試係有陽性嘅。咁又要照肺又話食藥，咁梁醫生覺得因為皮下檢測係好受其他環境因素啊，同埋你本身自己有冇打過卡介苗嘅，因為呢個係唔一定100%準確，係有可能受到其他因素影響，個結果係變做假陽性嘅。OK， 咁所以佢覺得做血液嘅肺嘅檢查係最準確，亦都最安全嘅一個檢查。比起嗰個皮下測試嚟講，所以佢建議大家係做血液嘅檢測嘅。
We want to thank our two experts here, Dr. Louie and Michelle Wang, and our production team behind the scenes, Sandy and Danny and Raymond, and especially Raymond, who does a whole lot. And of course, we want to thank you for joining us today. Because without you, there's no lecture, right? But I also want to let you know that the fact that you join us, you have become a smarter patient. You know how to advocate for yourself now. So take the information today and go and use it with your physician next time you see them. If you happen to be an immigrant, if you happen to be older, if you happen to be high risk with immunocompromised diseases and so on, really don't take this lightly, because I've seen, and it's in the most unlikely cases that they will break open. The latent cases will become active, and if you don't know you have latent, then you are at high risk when we get older, and we are all getting older, unfortunately. 咁多謝各位參與，咁我哋好多謝雷醫生同埋Michelle 啦，兩位講者同埋我哋喺幕後幫助我哋嘅工作人員啦。咁當然係亦都多謝各位嘅，你哋係覺得你哋好聰明咯，你哋即係其實好多人咧都係好多時都係參加我哋嘅講座嘅。當你抽啲時間嚟參加講座嘅時候咧，你真係會學到好多嘢，而可以幫到自己嘅，有幫到自己又幫到家人咧，希望係咁啦嚇。咁thank you so very much to all of you. Dr. Louie, I want to ask you a question. The COVID is back up again. And so we have vaccines, but not a lot of people haven't taken it. Can you please make a few comments about that while we have you on board, because you are an infectious disease expert, you deal with COVID too.
Well, I definitely think that it's a good time to boost immunity. And especially, I'm a little bit less concerned about younger people. Everyone has probably had COVID at least once, at least most people, and that gives you some immunity. But if you are older, 60, 65, or you have diabetes or anything that causes your immune system to be less healthy, I do think it's important to get a booster because you just never know. I think both COVID and flu booster vaccine is important to get because you have the tool. Why not use it?
咁啱啱阿劉博士就話問起過一樣，講起而家新冠肺炎又都好似死灰復燃翻咯喎，又出現翻好多例咯喎。咁想問下雷醫生對呢個情況有啲咩見解咧？咁雷醫生就話佢覺得好多人都其實已經曾經患過新冠肺炎至少一次㗎啦。咁對於年輕嘅一代咧，佢就唔係話太擔心嘅。但係長者65歲以上有糖尿病有任何免疫系統疾病嗰啲病人咧，佢強烈建議佢哋係需要應該打新冠肺炎嘅加強針嘅，嚟保護佢哋嘅。
And Diana, can I just, before we sign off, Michelle is our specialist in treating Chinese patients with TB.
Thank you again, all of you. I just want to also bring it to your attention that we do have a listserv, and that if you haven't been receiving our listserv email, please join us. Just all you do is just send an email to ahi.ucsf@gmail.com, and I'll add you on. And we also have a bilingual website, and that's at ahi.ucsf.edu. And I will double check and see if there's anything on tuberculosis on the website. If not, then I would try to get something there. Do you have anything bilingual from SFDPH on this?
I think we have many different materials that we'd be happy to share and continue to talk to you about increasing awareness.
Yeah, if you have anything that's already done in translation, please let me have it, and then I will add it onto the website. It's like the more the merrier, right?
Yes.
You can post it on your website. I'll post it on my website, and so that people will see it one way or the other.
Well, thank you for helping us to spread the word, Diana.
Well, no, thank you so much, and thank you again for all our participants, because now it's up to them to go and spread the word, and up to them to take the information and use it on their physicians when they go for their next checkup. So we learn a lot, we benefit a lot from your lecture. 咁多謝晒啦. Thank you again, everyone. Okay, so we'll see you next time again. Thank you.
Thank you.
Bye bye.